your passion, you can just sense it, you feel it, you breathe it, you live it. And, we are brothers of another mother, kindred spirit on our path to try and really help change the world to a better place. And, even what you were just saying right now, it's like, if you shine the right light, like onto a petri dish with these fibroblasts, which are like the healing cells, everybody, they literally move faster. They literally like start doing more stuff. You can actually see them move. You put a scratch down the middle of the thing and you watch them go faster across it. Like literally, there's no question about it.
We are back with another episode of Wellness at the Speed of Light podcast. I'm your host, Dr. Stefano Sinacropi, and I am plain old fired up today to have Dr. Scott Sigman on the program for what I believe is going to be a critical episode in understanding something which I'm so passionate about, and that is photobiomodulation and laser therapy. Now, a little bit about Dr. Sigman before we dive into the episode. He has prestigious training. He went to the University of Maryland Medical School, where he graduated with honors, and then off to Tufts University, followed by the prestigious Kerlan Jobe Fellowship. And then he's been in practice now for almost 3 decades, healing knees and shoulders left and right. As he likes to say, he likes to be called the Fro, and you'll see why. Obviously, I don't go by that name. On today's show, we're going to talk about some very critically important topics. Now, we've got a huge opioid crisis in this country, and if we can do and use technologies that can decrease opioid use, such as laser therapy, Exparel, and other methodology, why would we not? Is it not our responsibility to do that? On today's episode, we're going to dive into these issues and much, much more. Dr. Sigman has an amazing podcast of his own, The Ortho Show. I'm excited about getting on that program sometime later this summer. He is a guy who has a tremendous fund of knowledge, everything orthopedics, everything photobiomodulation. But what I really love about him and why I'm so excited, he's such an out-of-the-box thinker, and that's so needed today in our society to push things forward where we that see the patients on a daily basis see what they need, and we need to have courage and fortitude to push some of these things forward. So on that note, let's dive into it with the Fro, Dr. Scott Sigman, and I really hope you enjoy this one. Welcome back, everyone, to another episode of Wellness at the Speed of Light show. Could not be more excited to get a man that I've been trying to get on for quite some time, Dr. Scott Sigman, an unbelievably well-known orthopedic surgeon, and one of really, I want to say that he has been somebody that I have followed so intensely because of his passion for photobiomodulation, laser therapy, and my favorite word that everybody knows, and that is mitochondria and mitochondrial health. So we'll just dive right in because I've got so much to talk to you about, and we only have so much time. So one of the things that makes you so different than a lot of our colleagues is your absolutely tremendous will to spare people from being on opioids after surgery. And you call yourself kind of the original opioids in different ways, opioid-sparing, OG, whatever. So can you tell us a little bit about why so much passion about sparing people opioids in orthopedic surgery and how critical that is in this crazy environment, opioid overuse?
Yeah, I mean, first of all, from one podcaster to another, we are brothers of another mother, serial entrepreneurs, passionate about changing the way people think, changing the way doctors practice medicine. So what a pleasure it is to be on. I've been following you intensely as well, and it really is an honor to be here. So thank you so much. I appreciate it. Look, you and I are contemporaries, right? And you've been in practice for 20 years or so. For me, it's, closer to 30 years. But when we were brought up and going through residency, it was all the same story, man. whatever you do, it hurts, man. It's going to hurt a lot. You're going to take saws and drills to people, and you got to provide them pain. And pain was the management of pain was the issue of our generation of medicine. And I recall running around with my white coat with a script pad with pre-authorized signatures on there because I was
Yes.
writing so many prescriptions for opioids because we were said, you got to keep people out of pain. And they told us opioids are not addictive and they're inexpensive, and that's what you're going to use. And we were graded on it. And man, we hurt a lot of people, and it wasn't intentional, right? I mean, there were some pill makers and some people that were doing some bad stuff, but the overwhelming majority of doctors and nurses were just following what we were told to do. And so that really sort of struck me. I'll never forget it. I had a patient that was truly belligerent. He was out of control. He would call the office all the time. He was demanding medication. If you recall, if you didn't write prescriptions back then, they would send you to the Board of Registration of Medicine for neglect, right? And so I'll never forget it. I got a call from the police that this kid had, driven his car into a wall and had died, right? And it was a lot of it was related back to his opioid addiction. And what I thought was prior to that moment, that the people that were addicted to opioids, they just weren't smart, they weren't intelligent, they just didn't have the wherewithal to be able to do what everybody else was doing. But at the end of the day, that's not what it was. Addiction chooses you. You don't choose addiction based on a genetic profile. And so from that moment on, and there was one other story, if you don't mind. I mean, we had 5 kids in my local high school. My wife is a well-respected florist around the world, and she was asked at that time that 6 kids that had undergone elective surgery 6 months later had died of opioid overdoses, and she had to prepare the flowers for those funerals, and it was absolutely devastating. And from that moment on, I was just like, we need to do something better, and I searched for treatment options, and it's been a passion ever since.
Thank you for doing that. It cannot be more. I don't know how we can jump up and down more, turn blue in the face, do whatever to talk about how bad the opioid crisis is. And I absolutely love what you just said about how a lot of times it chooses you. I had Dr. Kenneth Bloom on. He's one of the world's leading psychopharmacologists, and he talks about the pleasure center of the brain and the reward center, and how there are certain alleles that we are all born with. And we, because of that, are susceptible to addiction. So once a person is started down this path, it can be a very dangerous road. And I, like you, have seen some people that had amazing professional careers, by the time they have come to me, are just in tatters. I mean, they've completely lost their jobs. They're addicted. And I know you know this with the fentanyl lollipops, with all this other crazy opioid behavior. And again, I don't know if it's anybody's fault, but we have both kind of grown up in an environment where there were some actors out there and some other things that kind of, put us in tough spots. And we just got used to prescribing opioids for all these people. And I do remember those days. And I remember the days of the reps being in our offices telling us about, the next iteration of the OxyContin pill. It's not just in those movies that they're making right now. It's real. Hey, we had 40s. Well, now we have 80s. Wow, what a breakthrough. And then, the other thing is that doctors feel like they are being judged by those little faces, the happy face up to the sad face and pain scores. And if you're not making people's pain go to a 0, somehow you're doing something wrong. Well, guess what? You just had surgery. We just cut you open. Of course, you're going to have some level of pain. Certainly, we can do things to mitigate that, but it doesn't have to go to 0 by giving you massive doses of opioids. But thanks for calling out the genetic predisposition of it. There's something called the genetic addiction risk score that we talked about with Dr. Bloom. It's somewhat controversial because people say that maybe it's going to, label you as a potential former addict. But wouldn't it be great to know who's at risk so we really know who not to give all these opioids to? So, great points.
I hope that that's actually coming. And I'm sure you've seen this too. I mean, I've seen physicians become addicted to opioids. I mean, what I always like to say is that addiction doesn't care about the color of your skin, the amount of money in your bank account, or your zip code. At the end of the day, if you're genetically predisposed to be a brittle addict to opioids, it will happen to you. And then you're affected for the rest of your life. It never goes away. I mean, so the care that we take to try and provide
Yes.
these alternative options is really critical to successful outcomes. And the other thing is there's never been a single study that's ever shown that adding opioids to someone that has a chronic condition will improve that condition. And if anything, opioid naive patients with a chronic condition should never be started on opioids, because then they've got two problems, right? They've got whatever their chronic pain condition was, and then an addiction to opioids as well.
Yeah, and I think speaking of addiction, I think one of the reasons that it is an issue, what you just said about wanting as physicians just to do something for people, I think as a society, we are addicted to quick fixes. We're just addicted to, hey, we're going to give you a pill or immediately go to some surgical or procedural option or some stimulator option. There's just so many non-invasive, non-medication options available. And I kind of kick myself because I didn't come around into some of these more, people call them alternative. I'm not going to use the word alternative. We're going to use the word complementary, because if we use the word alternative, then somehow it turns people off as there's something wrong with it, or only guys like me and you know, we're way out there on the fringe, all these fringe orthopods, they want to be using lasers and all these other medication sparing options. So calling it complementary, because I do think it's a great complement to use. On that note, before we get into lasers and photobiomodulation, which, you know, I know that we're both so passionate about, going to come kind of through the screen when people watch it. But no, I want to talk a little bit about your use of this medication, Exparel. And in my research on some of the great things you've done, you've been involved with Pacira, the company that has rolled out Exparel. I use it religiously for many, many years, and it allows us to get patients out in an outpatient setting after major spinal fusion, either same day or the next day. Can you talk a little bit about what Exparel is for our audience and what your experience has been, and any other nuggets on that before we get into laser therapy?
Yeah, I think it's a great discussion point for sure. And I think that it relates back to me for about 2012, 2014, when all of these things were happening and I was searching out a new concept and idea. And I've got this really uptight partner who's a total joint specialist. He's one of the AUKUS crowds. You know, he wears the blue sport coat and the khaki pants and reads every journal, so I don't have to, which is awesome. And one day he comes up to me, they calls me Siggy, and he's like, Siggy, have you read about this new stuff called Exparel, which is for our listeners and viewers, it's liposomal bupivacaine. We all know that anesthetics work, right? If you go to the dentist and they numb you up, the problem is they only last for usually about 6 to 12 hours or so. And I always say that's the storm of pain after any surgery is usually within the first 72 hours. If we can provide you a cushion and a soft landing, by the time, if we can get you beyond 72 hours, it doesn't hurt as much because all of those chemicals have been worked out of the system, etc. But anesthetics would always wear off at 12 to 18 hours, which is the worst possible time in that storm of pain. And so finally, somebody came up with this concept and the idea that if you take this medication and you put it inside of a liposome, which is like a fat cell, and it's just a slow release. And we have these products in medicine all the time. And that slow release phenomenon basically is a local anesthetic that can last up to 72 hours. And it was a profound change. It was something I had never seen before in clinical practice. And that happens every 5 to 7 years. And the nurses would come up to me on the floor after total knee replacement. They would all say, well, we know who Perbil and Sigman's patients are because they're up and walking same day. Right?
Yes.
I mean, prior to that, you remember in residency, you admitted patient to the hospital for 5 days for a knee replacement. They'd go to rehab for 2 weeks because they were all narcotized. They were all on opioids. They couldn't poop. They were all nauseated. They couldn't get out of bed because they were fuzzy. Yeah, they got a 0 out of 10, but they couldn't smile either, right? So, I mean, literally, it was tragic what we were doing, but we were pressured by so many, health societies and everybody to maintain the pain. And so we just saw a profound difference. And from there, I never looked back. Now, there are some other newer medications that are out now, too. Heron Therapeutics has ZynRelief, which is a gel-like long-acting anesthetic. So we're really starting to see some profound changes in the way in which we can manage. So the great news is, again, for our listeners and viewers, that you can safely and effectively go through major orthopedic surgery or spine surgery and have this block done with this medication. And you might not need any opioids. We're going to give you some. We're going to encourage you to take them if you need them. But for many of my shoulder and knee patients now, it is opioid-free surgery. Truly a profound difference.
I think it's great. I've seen a massive difference, in our practice. And like we talked about before, being able to get people up and moving right away. Imagine having a 3-level minimally invasive lumbar fusion, what those patients look like back in the day when we were training. I mean, you talk about,
PCA, you gave them the pump. They were pushing the pump thing.
zombies,
Just constantly pressing the
Yeah.
pump. Literally for 3 days, they never got out of bed.
No, absolutely. And, and sometimes that's necessary. And, still, obviously when we do open surgeries for, needed reasons, it's different, right? Exparel on a 3-level open fusion is a little bit different. So I don't want people to think that, they're good, but it helps. It certainly helps if you use it, but it's made a huge difference when you can get up. Imagine just having a back fusion and you're just up, going to the bathroom, walking around, talking to your spouse, hanging out with your family, and then just kind of getting ready to go home. It's just such a massive difference. I like the way you talked about it. You know how I describe Exparel to my patients? I tell them it's like a bubble bath. So make a bubble bath, see all the bubbles and as each of those bubbles pop, they're releasing the numbing medicine, or the lidocaine in this case, and then they're getting that relief. And it's true, if you can calm them down in that first 72 hours, they don't make those connections with the pain in their brain. And it's just such a great start, right? You don't have to be catching up on pain medication or over narcotizing them when they go home, because as you know, that's where they are at significant risk, especially if for some reason, they have any other significant medicines that are depressants in their system, because it can become very, very dangerous for them. On that note, laser therapy, man, you're the star here on the show. So I want you to talk about, how did the light bulb turn on, right? You got Einstein behind you, and Doc Brown, two guys where, the light bulb just kind of comes on. As great Scott, right? The Doc Brown. How did it come to you? Where'd this come from?
So great. So it's a really interesting story. So obviously, even back then, it's been 6 years now since we've opened up Ortholazer centers, and we started the franchise. But before that, I was known again as this opioid-sparing guy, willing to identify new concepts and ideas that many other doctors wouldn't, right? Doctors are skeptics. They don't want to change. They want to keep doing the same things that they learned, because that way they're not getting in trouble. They're not putting themselves at risk and all of these things. But for me, my career has always been innovation, a thought leader. What can we do to make changes that are going to benefit humankind and the way in which we care for our patients? And so that's how I approached. Then I was approached by one of the laser companies. I had known someone, Mark Pietropalli, who's a friend of mine, who's up in Skinny Atlas up in New York, and he had trained with Jim Andrews, who's one of the most famous orthopedic sports medicine. And Kevin Wilk was a physical therapist who's very well known as well. And they were using laser forever. Because laser had been used by physical therapists, the chiropractors believed in laser as well, but it never moved its way into mainstream medicine. And the reason is that it's just not taught in medical school curriculums in North America. So people just didn't know anything about it. If I wasn't taught it, it can't be right. I'm not going to try it. But I've always been willing to be thinking outside the box, trying new ideas. So I literally said, all right, I'm going to bring this into my office. We used it on a bunch of patients. It was working well. And I was literally almost kicked out of my office by some of my senior partners who were like, you are a snake oil salesman. You don't know what you're talking about. This is false advertising and marketing and all of this stuff. It was ugly. I'll be, perfectly honest, but I wasn't about to give up. So then I went to Italy, and I was like, if I'm going to stake my reputation on this, I want to learn more about it. So I went and met with Monica Monaci, who's one of the world's leading professors at the University of Florence in cellular biology. And so I went and met with her on 2 separate occasions. I went to the laser manufacturer to learn more about it. And basically, I schooled myself in photobiomodulation with some of the world's leaders. I said, okay, I've seen it work clinically. Let's figure out how it works so I can try to explain it, right? So I can share the knowledge so that people will want to be a part of it. And then I came back and I said, all right, my partners don't love me about this. I'm going to open up my own center. And then I bought 3 lasers. There's some dentist's office that was 5 minutes from my office. We opened up the clinic. I trademarked the name Ortholazer, and we started taking care of patients, and patients were doing really well. Then all of a sudden, the laser distributor comes to me and says, wow, we really like this model. We've typically been selling a laser here, a laser there, but we really like a franchise model. We sat down at Panera on a napkin over a cup of coffee,
Love it.
and we literally
I
came
love
up
it.
with a strategy and a plan to open up a franchise. And so we did. And it was November of 2019 that we got the FTC approval to sell franchises. And of course, March of 2020, the world comes to a complete stop, right? Because of the pandemic.
Yes.
And from there, it sort of has grown. But so it was a careful process. It was one that was risky in trying concepts and new ideas that I hadn't learned about. And then to try and, as you said, before we came on air, trying to convince doctors of new strategies and ideas is painful, right? I mean, they just don't want to hear about it if they didn't come up with it on their own.
We can talk about this forever. The level of pushback on some of these things. So the things that we're doing at our clinics, the laser is obviously it's the wow factor, because that has the most immediate response. Some of the improvements in patients' pain, not just postoperatively, but for things like reflex sympathetic dystrophy, people that have, all kinds of other chronic pain syndromes, people that have, really looked all over the place for some relief, wound healing. I know there's so much work in wound healing and the laser. That was some of the early work that, that was done. And yet, despite that, it's very difficult to talk to colleagues and explain to them something, again, like you hit it right on, where they haven't learned it in their schooling. And it's not right that I go by the philosophy that despite the fact that, I went to a great institution, I stood in the shoulders of giants. I know you've, used that terminology in some of your posts and some of that other things. I mean, I could not be more grateful to the guys I train with, right? Both in medical school residency and my fellowship. However, never heard any of this stuff, right? We get sold stuff as orthopods left and right? How many people are lined up outside your office per week trying to sell you the latest gadget, the latest thing, the latest operating room? They want you to use, for me, it's this screw and that screw and this system and this all day long. But yet no one ever approached me and said, hey, I've got this laser therapy, or we've got these photobiomodulation beds, or we've got this, pulsed electromagnetic frequency device, other than in bone healing. I've been using that forever, but now using the mats for overall bone health. And so it is very, very difficult. And what I want to really stress to the audience is somebody like yourself with such a world-class reputation. I love what you said. You would not put yourself out there until you were 100% convinced, looked it over backwards and forwards before Dr. Sigman goes out there and says, you know what, world, here come the lasers. If you thought in any way it could be, a mark on your career or something like that. And I feel the same. And that makes it even more frustrating, because we've been in practice, you longer than I, but if we're going to be out here and we are going to be banging the drums, just saying there's 6,000 articles on photobiomodulation plus, there is so much hard data, better than some of the procedures that we do, frankly. Some of these, photobiomodulation studies, very well done, randomized controlled, studies. And yet people look at you like you're a snake oil salesman. And it's the most bizarre reaction that I've seen. Although I will thank doctors like yourself who have pioneered the way on these issues, because it makes it a little bit easier for somebody like myself just to say, well, Dr. Sigman's doing it, so why don't you go watch his TED Talk, and then you come back and tell me that that's not real science.
I love it, and I really greatly appreciate all of your kind words. And let's walk the listeners through a little bit of this. It's
Absolutely.
like, where does it come from? What's the science? As you said, there's thousands of well-done clinical papers, basic science papers as well. So one of the questions I always like to ask anybody that's questioning laser, if I get people in a room and have dinner with them, by the end of the conversation, we've usually, cracked it open a little bit. So the first question I ask, do you believe in photosynthesis, right? And everyone says, shakes their head, yeah, photosynthesis, right? Well, yeah, right. Why? Because we're a species that lives on a planet with the sun shines down, the trees grow from the sun, they take the carbon dioxide, they make oxygen, the plants grow, which provides sustenance to the species on the planet. So I ask you, here we are. We as human beings, Homo sapiens, are a successful species on this planet for 3 500,000 years. Should it come as a surprise that in our deepest genetic code, we are sensitive to light and light is beneficial to us as human beings?
Yes.
And the short answer is yes. Everybody says, I believe in photosynthesis. I believe in vitamin D, right?
Yes.
I mean, you got to go out in the sun. Well, look, I mean, the reason we succeed, okay, is because we, as an organism, have evolved over time. And so let's go into your mitochondrial health, which I
Yes.
love that you
Yes.
describe, right? And so what are the mechanisms? So the point is, if you can shine the right wavelength of light, as well as the right frequency of the light, and the right intensity of light, you can literally change the way cells behave. And that is a positive change in how things happen. So most of the things that happen inside of our body are mediated by DNA, and then there's RNA, and then they make these proteins, and the proteins are called cytokines, and there's good cytokines and there's bad cytokines, right? And so the bad cytokines create inflammation and pain, and they decrease healing, and they don't allow us to do all the things that we want to do. Pro-inflammatories are the bad ones, and the anti-inflammatories are the ones that we want. And so those are, if you shine that wavelength into the cell, then the mitochondria gets excited and it starts expressing these new healthy proteins to change the way things happen. We bring in blood flow, bring in the healing cells of the body called fibroblasts, which can lay down new bricks and new ways in creating healing for our cells. And from all of these things, we generate new cytokines that help our nerves, which is why reflex sympathetic dystrophy or patients that have nerve injuries, we block the cytokines for arthritis that make pain and inflammation. So what I always like to say is we're not treating diagnoses with laser. We're treating cellular health. We're changing the milieu of where the inflammatory condition is so that the body can heal itself. And it creates a stimulus to make that happen. Can I tell another interesting story about?
Absolutely. Love cytokine. I could talk cytokines all day.
Okay, so it's March of 2020. I'm sitting in my house. The world does not need an orthopedic sports medicine surgeon. We're literally in the midst of a worldwide pandemic. I got nothing going on, and I'm thinking to myself, what's happening at the hospital? And if you recall, it was terrible times. It was the first cycle of the first virus, and it was literally killing people by the thousands. And the hospitals had no cure of any kind. We had nothing.
Yes.
You were basically treating patients with oxygen. They tried to intubate them and put them onto the machines. They all died. And literally, it was so demoralizing. It was the worst time in medicine in my entire career. And they kept saying one thing over and over again: cytokine storm.
Yes.
Cytokine storm.
Yes.
And I'm thinking to myself, okay, I know my laser works and it creates the good cytokines. Yes. What if we could try the laser for patients that have COVID? So I went to the hospital. And I said, I'd like to bring in my $70,000 laser, and I'm going to donate it to the hospital, and I want to start treating patients to see if it will help. Say, well, you got to go meet with the IRB. I meet with the IRB. I've got an FDA, cleared, approved laser. That they're like, fine, that's for muscles and joints, but you're going to laser the lungs. We need some more advice. You need to contact the FDA and get back to us and let us know if this is something you want to do. So, like everything else in my career, I'm like, you can't just tell me no. I mean, that to me that means yes, right? That just means you got to try harder. I picked up the phone. I called the FDA. 6 hours later, I got a phone call back.
Wow.
I mean, it's unbelievable, right? You can't make it up. So I had a neuropathologist from the FDA who basically he says, send me the specs of your laser, send me your FDA approval letters, let me review it. Went back and forth for 3 days. And I'll never forget, he sent me an email 4 days later. You are a low risk assessment for the use of your device for the treatment of COVID. You have FDA backing to go back to the IRB. The IRB said, wonderful, that's what we needed. Then had to develop a protocol. I'm like, dude, I've never lasered a lung. I mean, how am I supposed to? So I literally go Google laser treatment, for COVID. I swear to God. So I go to ResearchGate. So for our listeners, that's sort of like Facebook for like geeky researchers, right? That's where we all live. Sure enough, there was a study. These two Iranian-born, one was Iranian, one was Romanian, who had trained through Russia on lasers, had just written a theoretical paper on the use of laser. She DM'd me back 5 minutes later I said, I need help. I don't know what to do. I sent her the specs. Literally an hour later, she sent me the parameters of what I should be using on the software to use laser for COVID.
Unbelievable. That's a
So,
amazing story.
so I bring it in and we start lasering people, write this paper up. Okay, we literally start lasering people and you won't believe it. The roadblocks never end when it comes to new technology and skepticism. I was physically thrown out of the hospital with my laser because the hospitalists refused to allow their patients to have laser.
Oh,
We had treated 10 patients, 5 in the control, 5 in the treatment group. It's unbelievable. The people that were treated with the laser went home 4 days later after laser, never had another symptom, have been asymptomatic ever since, and literally had worse chest x-rays on arrival compared to the controls, and the controls all die. And I was literally kicked out of the hospital. But I was like, this is still too important. So we figured out a way to write a paper. I brought in the Canadians and Monica Monachi, and it took us a year, but we wrote the paper up. And then we distributed through case reports as well. It was never accepted here in the States, but I can tell you in the Czech Republic, Brazil, Russia, India, our protocols were used to save the lives of patients with acute COVID. I mean, it's just an unbelievable story.
Thank you for sharing that story. That's a great story. And I can tell you kind of a similar story, but not using the laser. So my partner, Tram, in our wellness centers. So first of all, he's the one that first, now he is, he's a trainer. He's worked with all kinds of athletes. He worked with Adrian Peterson on utilizing this electrostimulation device that he actually invented himself. And so he had all this stuff. He put me onto the laser. But one of the stories that he told me, this is nowhere near as exciting as your story, was he got a phone call and ended up giving a high-end bed, class 1, right, device, which was a red light bed with all the infrared different settings, right, same wavelengths, but not as powerful as a class 3 or class 4 laser, to Steve Harvey when he had COVID. And to this day, Steve Harvey credits the use of the red light bed for saving him.
I have no doubt about it. Absolutely validate that. We then started using it for long COVID, all these
Yes.
unexplained persistent pulmonary
Yes.
symptoms. We had so many nurses because they've been taking care of the
Yes.
patients.
Yes.
And we cured one nurse after another with
Yes.
long COVID. We went to Northeastern. It was a wonderful university here in Boston. I had a friend of mine who was such a believer. And we went through all of these hoops to be able to try and get the study going, and they declined. And so it just is like one more roadblock after another. But I want our listeners to understand that there's some really good news happening about laser. And that is our franchise that we started, the Ortholazer Orthopedic Laser Centers. We now have 20 centers open across the country. We're committed to another 20. We're bringing on a new CEO who's one of the OG of orthopedics, Rod Meyer, who's from Warsaw, Indiana. He's starting for us literally in about 2 days. So we couldn't be more excited. And we are going to democratize laser for patients across the country to provide them, what's the word? We don't use alternative, we use complementary.
Yes.
We're going to use complementary mitochondrial healing. I'm expanding your brand here a little bit more. And basically that's going to allow patients that are suffering from arthritis, from nerve compressions or chronic pain syndromes. We can use this laser without needles, without medication, without side effects, safely and effectively, and we can help you with your pain and keep you moving. And so there's really some really great opportunities coming down the line for our patients.
I'm excited. I love what you're doing with Ortholazer. Outside of kind of just treating orthopedic stuff, I'm so glad that you brought up the COVID thing. And people need to know, because I've actually posted this, and actually we've treated a number of patients now for post-COVID, especially brain fog. Now, the studies clearly show, okay, that whether you use whole body photobiomodulation or transcranial photobiomodulation, the brain fog goes away. It's a staggeringly high percentage of patients that recover. We just had a 17-year-old who has had long COVID for 3 years. And he just did a testimonial after doing photobiomodulation and some laser therapy and some other things. Dramatic. He's been to multiple large institutions to try to get help for his long COVID. He treated with us for in 1 month time, the progress that he made after 3 years of suffering. Imagine suffering between the ages of 14 and 17 with long COVID symptoms. It's
It,
devastating. Think about how long, right? For us that are a little bit older now, right? A month goes by in the blink of an eye. For these young men, right? Young men and young women, a month is forever. So make 3 years at that age is like a big, big
that's the
percentage of your life.
formative years in your high school where you're getting educated and learning, and you basically can't concentrate that time. I
Yep.
mean, look, I just went through an interesting cardiac event, just so and it's just well known. I published it. I did a public service announcement kind of thing, and so everybody, I had a 90% occlusion in my LAD, and I went in basically thinking I was going to have to get three vessel coronary artery disease and a bypass graft, and thankfully I found this amazing like 12-year-old cardiovascular interventionalist. At least he looked that old, but he was old enough to do it. But he literally rotor-rooted me and put this
Yeah.
stent in, which nobody said that they could do. And I'm like asymptomatic now, which is
Awesome.
amazing. But I did some research, and there's some great studies for the
Yes.
use of photobiomodulation therapy post cabbage, which is your bypass. They
Yes.
literally will laser you in the hospital
Yes.
right across your sternal incision, but they also do it over the brachial artery and vein, so you're circulating your entire
Yes.
blood. So I found that fascinating as you're talking about the brain fog for that individual. Now, did you use transnasal or transcranial? I mean, how do you get the laser across the bone and into the brain?
I mean, that's a fantastic question. And so the studies out of Harvard. So just to go back, if we can talk about a little bit. So Harvard is really leading the way. I actually have Paolo Casano, one of the bigwigs over at Harvard. He's on the show next week. And, I love what they're doing. In 2021, they did a randomized controlled study on concussion, and they compared sham therapy to transcranial. Actually, they used it was more like a class 1, right? They were just using photobiomodulation. It's interesting. It was a dramatic difference between the patients that were in the photobiomodulation group versus the sham group, like dramatic. They knew that their symptoms were going to get better because clinically, we know it's amazing for concussion. What was interesting is the first study that ever showed healing of the white matter tracts on MRIs, which was fascinating. The reason I even bring that study up is one, obviously, to talk about concussion, but before that, they did the cadaveric studies of their intensity of their helmet that they created specifically for that study. Only 3% of the light penetrated the brain. Again, it's those near infrared wavelengths in the 800s, depending on what you want to use. I mean, there are different, wavelengths that work. And so we're using, in our clinics, we're actually using the Aspen laser, which is a quad laser. So it has 4 different wavelengths. It's much more powerful, though. It's a class 4 laser. And so we don't know if the studies have been done in a cadaveric model, but we've got to assume that, it's a higher percentage than that. But we're seeing the resolution in concussion, brain fog, all kinds of PTSD, those kinds of things. It's pretty dramatic. Now we're telling them it's off label, but we always refer to the wonderful scientists at Harvard. And if you haven't gotten the book, you got to read Hamlin's book, Photobiomodulation of the Brain. That book, I read that. It is so outlined. It's crazy. I outlined that book like back in the medical school days, right? Where we had so many outlines, the pages would kind of be crinkled with so much moisture. Great book. It sounds like you've read it because I saw you shaking your.
He's the godfather, the
Yes.
OG of
The OG.
photobiomodulation therapy, literally out of Bass General Hospital. I'm not sure he's
Yes.
still there, but I got to tell you a funny story.
Yeah.
So I got asked to go August to London for the PBM 2024 International Conference, which it used to be WALT, which is the sort of the Laser Therapy Society, but there was controversy about low level versus high level.
Yes. Yeah,
but the bottom line is I'm giving 2 lectures. Hamlin's going to be there giving a lecture. But here's the problem. I'm like an orthopedic surgeon. I'm a clinical orthopedic surgeon. I am not one of these PhD science people, know all that crazy mitochondria crazy stuff like they know it. But I'm going to get up there. I'm going to represent. I'm going to do the best I can to get up there against the big boys.
Yeah. You know what I would say it's funny because I talk about those meetings all the time. And I'm the co-chair for the Society for Brain Mapping. And it's interesting because we're going to do a lot of photonics, photobiomodulation, stem cell therapy for spinal cord injury recovery and spine. Love to have you if you're around in February of 2024. It's just right there in Los Angeles. But it's so fascinating because there's these brilliant people. They're brilliant. I can't wait to talk to Cassano, right? He's an MD, PhD. I mean, he's amazing what they're doing over in Cambridge, right, on its work. And the problem with a lot of what's going on in photobiomodulation to me, and you're going to this meeting and all our meetings, right? Even our ortho meetings, is a lot of times we're preaching to ourselves on whatever we're talking about, right? You go to ortho spine meetings, we just keep talking about how do you treat a one-level spine? How do you do that? You go to these other meetings and it's very deep, detailed science. That's all good and well, but honestly, that is not what is going to bring over our colleagues into the camp. It's the way you speak about it. It's everything you said on today's podcast. I mean, you're saying it in such an easy to digest way. The truth is, our colleagues have no idea what we're talking about. It's not because they're not brilliant people. It's because they literally have no idea what we're talking about. They could also learn to speak Chinese and Russian if they'd like, but they don't understand those languages currently, just like they don't understand the language of photobiomodulation. And so the way that folks like yourself and I'm trying to follow behind you speaking about photobiomodulation, and by the way, thanks for shouting out my red light therapy thing that I did on my screen, to try to educate on a level where people can really understand these little nuggets. But anyway, just going back to those things, so happy that you're speaking at these things. I think actually it's more beneficial doing it your way rather than going up there than talking about every single little thing that happens in the complex on the mitochondrial wall. Because again, our colleagues, unless they're big into basic sciences, they have no idea what happens. They just know mitochondria, powerhouse of the cell, ATP, right? Telling them about complex 4.
I couldn't go there anyway if I wanted to, but I love what you're saying, actually. My brain's been moving in ways now, right? It's cross-pollinization, right? I'm going to bring the clinical. You guys know the cells are part of an organ, which is part of the entire body, which has a tendency to move and hopefully not get eaten by saber-toothed tigers. And we're going to tell you how light, God on the first day said, let there be light. You know, it's one of my favorite things to say, that how light can help patients to heal and to keep moving. It's truly profound. And I'll tell you another thing, right? For 20 years, the first 20 years, Stefano, of my clinical practice, I was a mechanic. Okay. I would use screws. I would use saws. I saw everything as a mechanical problem that I could fix. But in the last 10 years, I've really become a biologist, which is the study of how all the organs work together. It's about nutrition in surgery now, how we need to focus more on that. It's about pain relief for our patients. It's about expressing how we can help you to heal. It's about stem cells, orthobiologics. What other things can we add in? And, you know, every orthobiologic patient that I use now that does a PRP injection, for example, for knee arthritis. So our listeners, you draw blood from your arm, you get these layer of platelets that come spinning down, and inside the plates are these awesome growth factors. And you can put the growth factors into where inflammation is, and it can help to turn off the inflammation. What do we do? We put the PRP in the knee with ultrasound, and you get 6 laser treatments afterwards, because laser is synergistic in that process of healing. And so we utilize both of those things together. So I am now using my biology degree from Tufts University from 1986, probably as much, if not more, than the mechanical things that I learned through my orthopedic residency.
Absolutely love it. I talk about that ad nauseum, my change, my shift. I've started on the process of writing a book, Diary of a Reformed Spine Surgeon. And that is exactly what you just said. I went from a technician. All I did was obsess about my technical abilities and different techniques and learning different things and this and that. And sometimes we kind of forget other things like mental health, nutrition, all these social support. And then obviously the passion is, like, just like what you said, is in the biology, is in the basic science, being able to go back to your basic science and taking that, which a lot of times we just forget about. We don't even talk about it anymore, but then taking that, going back to the drawing board and being able to use that to help alleviate patients' suffering and what they are going through is just a beautiful thing. And I just love the way you put it. One of the things that gets literally the hair standing up on, my arm is the word photobiomodulation. Okay. Let's talk about this for a second. Light, you're taking light, right? Bio, obviously biology, and you're modulating it. So if you read the thing that turned me on so much when I started going hardcore into the basic science of photobiomodulation, when you look in the petri dish, right, at the most basic level, you shine these light at the certain wavelength and at the right frequency, right? And the cells literally change. It literally changes. The expression of DNA changes and then RNA. And guess what? When you change that expression, it's not just that you're creating that ATP, you're telling the cell, hey, don't die. Hey, you're good, right? Those auto programs of apoptosis, they're changed. And how our colleagues don't get so excited about it that literally they're losing sleep at night, I don't know. Maybe we haven't turned blue enough when we're, making these discussions. A little harder for me. I'm a little, I have a little bit more pigment than you do. So if I turn blue, it's really, really probably,
But
I
little
probably
bit different,
need some heart surgery.
difference in the hair too, a little difference in the hair for those that are just listening or not watching as well. But no, I mean, your passion, you can just sense it, you feel it, you breathe it, you live it. And we are brothers of another mother, kindred spirits on our path to try and really help change the world to a better place. And even what you were just saying right now, it's like if you shine the right light like onto a petri dish with these fibroblasts, which are like the healing cells, everybody, they literally move faster. They literally like start doing more stuff. You can actually see them move. You put a scratch down the middle of the thing and you watch them go faster across it. Like literally, there's no question about it. Photo, light, bio, life, modulation to effect, photobiomodulation therapy. For our listeners as well, if you want a short 13-minute description on my TEDx talk. You can hear and see it anywhere. Just Google me, Scott Sigman TEDx. It's a really cool way of describing in simple terms in an easy way for you to understand why this works as well as it does.
It's been great talking to you. We can talk forever.
Oh, dude, all day long. We're doing a home and away. You're going to come on my podcast, the Ortho Show podcast. We didn't talk about it yet, but you're going to be a guest in about 6 or 7 weeks, something like that. But we're going to love to have you on and continue the conversation, all the great stuff that you're doing.
Just in closing, I just think a couple more things that I'm so excited about. In the future, think about being able to treat things like spinal cord injury. We talk about like those secondary cascades. It's no different than the secondary cascade that happened in COVID and what you saw when you were treating lungs with it, right? We know it's not that initial injury, it's the inflammation that just happens afterwards. Obviously, if you have a cord transection, that's different. But if you have more of a crush injury, and so I just posted on my channels a study at a University of Birmingham in the UK where they did the rat crush model. They did a cord crush model in the rat and basically shone a light on it and then created this little probe. So they did it externally and with a probe with excellent results in recovery in the rats, right? There's this specific, rat model. If you look at things like what they are doing, especially at Harvard and some other institutions in Parkinson's disease, reducing tremor, even shining light on the frontal lobe in normal individuals that have some cognitive decline, they immediately improve their cognitive function. How is our community not getting super excited about this stuff? It's hard to fathom. So on that note, there's so much to talk about in photobiomodulation and lasers and everything else in the complementary space. And I cannot thank you enough for coming on the program today. I look forward to coming on your program here in in a month or two and continuing the conversation. So thank you so much for coming. Is there anywhere else that you want people to find you? Anything else they should know about you? How can they reach you if they just have a question that comes up from the show?
Well, first of all, you probably can't turn on a computer without seeing my face somewhere. So I am pretty prolific when it comes to messaging. So on LinkedIn, you can find me easy. Just find me open. I got 800,000 people or so that follow me there between first and second. I'm really excited about another project that I'm doing, which is Physician Brand RX, which is a book that I'm writing with Matthew Ray Scott. So just like physicians have a hard time learning concepts and new ideas, they really suck at being able to communicate with patients about who they are, what matters to them, what their brand is. And so we're really trying to help educate doctors in the brand new world that digital marketing of who you are helps you to find your ideal patients so that they can come and find you. So we're excited about that project. And, as far as the rest of the stuff that I do, I'm very proud of the medical device design things that I do, professional education. I'm everywhere. Follow the fro. That we didn't even get to the fro part,
We
but
didn't even get to the fro.
I know.
That was
Hashtag follow the fro.
I
That's my
love it.
tagline. So, again, everywhere and anywhere, we're happy to talk. DM me on LinkedIn. I'd be happy to answer any questions.
Well, I appreciate it, and you certainly are prolific. Love following you. Love your messaging, by the way. And I follow Matthew as well and have had communications with him. It is so important for us to be out there. I actually had Dr. Betsy Grunch on my program, and she is a Insta famous, if you want to call her or whatever. And it was just a great show. And sort of the entire point of the show was how important it is for experts to be out there so that people can have relatable individuals that they can go to that are truly experts in their field and not just kind of, late to the party, they decide they're an expert. They're getting their information from everywhere. So I encourage them to follow people like you on topics like photobiomodulation, marketing yourself, implants, everything orthopedics, opioid-sparing, Exparel, you name it.
We got a lot going on, brother, for sure. Can't thank you enough for the opportunity to be able to share my message. Keep it up. Wellness at the speed of light, brother. You are in charge.
All right. Well, everyone, I hope you enjoyed this episode of Wellness at the Speed of Light. Hope you message us. Let us know what you think about it. Give us some questions on photobiomodulation or whatever else you can think of. And until next time, we'll see you in the next episode of Wellness at the Speed of Light.